My presentation will be on racial and economic healthcare disparities in the United States. First of all, we'll talk about what exactly are healthcare disparities. Well, they're inequalities in healthcare quality and access to healthcare based on socioeconomic status such as income, race, ethnicity, and employment. The official definition of healthcare disparities from the Health Resources and Services Administration is population-specific differences in the presence of disease, health outcomes, and access to healthcare. So who exactly do these healthcare disparities affect? They affect the disadvantaged the most, whether it be socially or economically. Those with lower incomes, particularly those below the poverty line, the uneducated, the unemployed, and racial minorities, particularly the Black, Hispanic, and American Indian communities. In this country, there's a big tie-in between the disadvantaged economic status and race. The Black, Hispanic, and American Indian populations are exceedingly likely to live in poverty when compared with the Asian populations and the white populations. With lower income and higher unemployment rates, there are lower rates of insurance in these communities as well as less access to quality health care. Here's a graph about diabetes in this country. It ties in with the subject of race and poverty, and it shows that lower income and living in poverty is the key element of healthcare disparities, with higher rates of diabetes in low income families when compared with Black families, Latino, Asian, white, and high income communities. So how exactly do these disparities come about? Lack of insurance is a big part of these healthcare disparities. With lower rates of employment in the Black, American Indian, and Hispanic communities, there's lower rates of insurance, as well as lack of money to pay for medications and co-pays and deductibles, even if they do have insurance. There's also a lack of access to resources that promote healthy living, such as proper diet and exercise, as well as lack of access to proper healthcare facilities and lesser quality of healthcare in overcrowded facilities with overworked staff. And here's a graph about rates of insurance in this country. Latinos are much more likely to go without insurance than any other demographic in this country, with 41.6% of all Latinos lacking insurance. The least affected group of people in this country is Asians, with only 14% of Asian people lacking health insurance. So why exactly do these healthcare disparities matter? These inequalities are costing innocent American citizens their lives. The Black population has lower life expectancies and higher infant mortality rates when compared with the white population. Black and Hispanic people are more likely to die of the same disease than white people. And an example of this is that 9.4% of the Black population has asthma, compared with 7.6% of the white population. Despite fairly similar rates of asthma in each population, Black people are 3 times more likely to die of the same disease. So what can be done to combat healthcare disparities? In the article, The Costs of Racial Disparities in Healthcare by John Z. Ayanian in Harvard Business Review has a 5-step method to reducing healthcare disparities. The first would be to provide insurance coverage and access to high-quality care for all Americans, promote a diverse healthcare workforce, deliver patient-centered care, maintain accurate and complete race and ethnicity data to monitor disparities in healthcare, and to set measurable goals for improving quality of care and to ensure that goals are achieved equitably for all racial and ethnic groups. It's very important for all healthcare workers to be aware of that and to do everything in their power to combat these healthcare inequalities.